Welcome to The PA is In, the show created by PAs for PAs, where codependency with your supervising physician is a thing of the past, optimal team practice is the future, and physician associate has taken the place of physician assistant as the professional title of choice. I'm Tracy Bingaman, and I'm obsessed with redefining what success as a PA looks like and what it feels like. Here you'll find the mindset shifts, systems, and processes I use to escape healthcare burnout and integrate my work into my life. Work-life balance is a myth, and an integrated life where you thrive professionally, not a balancing act, is the goal here. My mission is to help you to grow into a unicorn PA who loves their job, has abundant energy, time to spare, and work-optional financial freedom. The PA is in. Have you ever wondered how people become healthcare executives? Today's guest, Michael McClain, is going to tell us how he went from seeing patients in an exam room to running the boardroom, how he worked his way through the ranks of healthcare up to be an executive and ultimately to be an entrepreneur running his own consulting company. If leadership, but not just clinical leadership, executive leadership has been on your radar, or if you're just curious, are there PAs in CMO positions? Are there PAs functioning as medical directors? You are not going to want to miss this interview. Without further ado, here he is, Michael McClain. Michael, welcome to the show. Thank you so much for being here.
Thanks for having me.
I would love it if you could take a moment to introduce yourself to our listeners. Tell us a little bit about you and what you do.
Absolutely. So I'm Michael McClain. I am the founder and managing member for LeftCoast Healthcare Advisors. That is a fancy term for saying I run my own business. And I'm a healthcare consultant, but I started life as a PA, over 20 years ago, 25 years ago, darn near. And I don't know how I got here, but I'm so happy I did.
Awesome. Well, I would love to unpack a little bit today some of the steps that you took to get where you are. We love to, on this show, highlight non-traditional career paths and show people how to get from where they are to where you are. So if there's someone listening that said, how did you get to founding your own company? What did you do in the meantime? What did that trajectory look like?
Sure. Loaded question, loaded answers coming.
What have you been doing for the last 25 years?
Absolutely. What's funny is I did not set out to become a healthcare consultant. I started uh, with a lot of focus as a hospitalist and critical care PA, and I loved my job. I was in a large level one trauma back in the Michigan area, large hospital, lots of services. But honestly, burnout started to set in. There's only so many times you can work nights, weekends, and holidays. And be married. My wife was a trauma nurse, is still a nurse, and we wouldn't see each other for what seemed like weeks on end. And one afternoon, I had a conversation that I remember clear as day, which was with an orthopedic surgeon friend of mine who said, "Have you ever thought about running a business outside the hospital?" And I'd never thought about that. I mean, I'm a PA. I'm a care provider. I don't run businesses. I just work in healthcare. And that conversation proceeded to open several doors. And over the next few years, I found myself leaving really the hospital leadership role, joining a group of orthopedic surgeons, colleagues, who were starting a surgery center. I didn't know what the heck that was. Ambulatory surgery center. I mean, I'm an internal medicine guy. What is this surgery thing? But as it turned out, what they were really looking for was someone with a clinical mindset to run the operations and help them avoid cost. And I was like, oh my gosh, this is what I do every day as a hospitalist. I avoid cost. I help find ways to get through the system. Did it take a lot of extra work, a lot of effort to sort of learn the mechanics and the language of a new business? Sure. But flash forward now 20 years from that conversation, And I've spent time as an ASC administrator, a surgery hospital CEO. I've run large orthopedic groups. More recently, I was an executive at Providence and overseeing 42 surgery facilities on the West Coast. And now, the owner of my own small consulting firm focused on the ambulatory surgery space. But it all started because of a conversation, because somebody thought more of me than I guess I thought of myself.
It's interesting. That's a common theme. When I ask someone who is in a unique position, oftentimes they point to a conversation or a person who said, "Hey, I see something in you. Have you ever considered this?" And there's several aspects to that, right? It's the conversation, it's leveraging that connection in a meaningful way. And also, it's sometimes that person posing something that makes you question what you thought your career would look like. So this is obviously when you graduated PA school 20 years ago, you didn't think someday I'll own a boutique consulting firm for surgery centers, right? That was not the plan.
Yeah, I don't think that was even, not only was it not on the list, it wasn't anywhere even a thought of being on the list.
Sure. Yeah. I feel the same about hosting a podcast talking about the PA profession. Like this was not on the radar for me in terms of what do you want to be doing with your career and what do you want to be doing with influence or, growing things. So there are several people listening at this moment who think, well, that's maybe good for Michael, but I am not an executive, right? I'm a provider. Talk to that person who feels underqualified to make a switch from clinician to administrator, especially if that administrator happens to be an executive. Are we qualified? And how do we know if we are?
Yeah, it's funny. I call it, the mysticism of the MBA. I remember being a provider and thinking, oh, there's all this additional education and training and knowledge, and what I would tell you is that from a practical standpoint, PAs have the same set of skills and of uh, the same set of experiences to apply to operations. Uh, you just have to think about things differently. And so when we approach patients, we organize our thoughts. We critically approach problems. We think about multiple solutions at once as we put together a differential diagnosis. Um, Healthcare leadership is exactly the same thing. Granted, there's probably a few more boring meetings, and but it's still the same type of critical thinking, which is where are we trying to go? What's the problem we're trying to solve? What are the steps that we need to take to either, in our case, evaluate and treat, or in the case of an executive, uh, analyze, the information in front of you and make plans to move forward. And then, most importantly, continually reassess what you're doing. Is it working? If it is, great. If it's not, change it. It's the same skill set. And while maybe we don't get the recognition at times as PAs that we have that skill set in place, I would argue that every PA I've ever worked with is equally positioned to take a medical director role, a chief medical officer role, an executive role in an organization once you get comfortable with the content. But you've got those baseline skills. All you need is the opportunity and someone that believes in you to sort of help open those doors for you.
So if someone is listening and they are interested in that and they're saying, okay, CMO, medical director, those are the positions that I want to be vying for. What are some of the stepping stones that that person can do to get comfortable with that content? Because I feel like very few people go from full-time clinical to the CMO of an organization. What are the stepping stones in between those two things?
Yeah, it's a really good question, and I think it's different for everybody. I think the first step, though, is really doing an inventory of yourself, and your own background, and understanding what am I good at? What are the areas in my background? Most of us Becoming a PA was not our first rodeo. For many of us, it was our second or third rodeo. Maybe we had other careers or other opportunities before we got involved as PAs. But doing an honest inventory of what are my skill sets. The second piece, I think, is what's my timeline. Uh, it does not happen overnight. If we talk about that pivotal conversation, it probably took 2 years from the time I had that conversation to start thinking about, well, what does a practice manager have that I don't have? What are the gaps either in my education, my skill set, or maybe just experience that I'd like an opportunity to explore and get better at? And for me, working in a large academic medical center, there was no shortage of opportunities to get involved in committee structures, in credentialing and privileging. They say get good at what nobody wants to do, uh, and you find yourself invaluable. And so for me, billing and claims information seemed uh, like a no brainer. And I think for a lot of PAs, sitting in that concept of how do I bill and code for my services? How do I bill and code for my physician? How is the overlapping of their billing and coding affecting my contract? For me, that reimbursement area became an area of expertise. I just spent a lot of time. I started digging into it. And before you know it, I started getting asked questions like, how would you approach adding two PAs here? What is the medical staff bylaws? How should we structure these to allow us to take advantage of using our PAs? And so I became a content expert, a subject matter expert in a space where there were no other clinicians having those conversations. And that allowed me to take a step forward. And I think that's where recognizing that it's not an overnight transition, but as you start to identify areas where you have a strength or interest, exploring those, whether it's professional CME, committees, there's always a shortage of clinical leaders or at least clinical providers to provide input. Step into some of those gaps, observe what's going on, and fill the niche. For me, it ended up being surgery centers. For you, it might be something entirely different, like podcasts, you know. But fill the niche and become an expert at it.
Yeah. Yeah. And with that comes some increased visibility. So I have found in my career that when you are distinguished and sort of called out as the person who knows how to chart well. So when we went to inpatient and outpatient Epic, I had to become an expert because the surgeon I was working with was definitely not going to be, right? We both knew that. I was like, I know you're not going to master this system. So if I'm going to be the one answering your questions, I might as well get good at it. But to the point where surgeons in other specialties were asking me, do you know how to order this? Or I'm stuck and I don't know how to get out of where I am. I wasn't like a formally designated super user. There was no like designation that made me any better at Epic than anyone else. But when you start solving people's problems and someone is having one, someone says, hey, did you ask Tracy? Like, because she probably knows how to do that thing. And that recognition, I think sometimes makes us a little uncomfortable, but it also distinguishes us from all the other clinicians and all the other people who are just sort of charting and minding their own business and doing their thing. So that recognition is not bad, right? That sets you apart from other people.
That's so well said, and I would take that even one step further to say that uh, not only being recognized, but being able to establish yourself as a personality that someone can come to with questions. Um, that approachability is desperately missing in leadership roles, and I'm sure every one of us has worked with a leader, whether it be a clinical leader, an administrative leader, who's brilliant and completely unapproachable, that you're terrified to ask a question of. Um, having that expertise and being approachable starts to set you apart and opens the doors for opportunities, whether it's in your own practice. Hey, we're gonna set up orientation programs. Would you like to help us with this? Um, when there are gaps in leadership or staffing where you can step forward. For me, we were in between hospitalist practice managers, and it gave me the opportunity to step up and say, "I think I can do this." Um, the downside of that is, and you and I talked about this in the past. I think this is really important is that there is a period of time where you're likely to be doing a little more work than you are today because you're still trying to maintain a full clinical schedule, and you're trying to dip your toe into a new space. And so that going back to that inventory, that self inventory is now the right time. Um, if you're having, your first child, might not be the right time to tackle something new. But understanding that there may be some time and even some money sunk into that new space, that's stretching those new muscles. Um, but again, I think it's worth it, and it's so desperately needed.
Finding the perfect gift for everyone on your list, well, it can be quite a challenge. And when you're a busy professional trying to choose thoughtful, high quality, personalized gifts, you know that all too well. Thankfully, there's KML Expressions, a PA mom owned business that can personalize almost anything. From ornaments to occupation specific items for PAs and more, Crystal has got you covered. Don't even get me started on how cute her stuff is. Even the hardest people to buy for, there's a gift for them at KML. Head to the link in the show notes to place your order today. Yeah. And I think there is a little bit of just with entrepreneurship, as you're investing time and money and energy on the front end before you get a payoff, that you're sort of saying, hey, I'm going to raise my hand to be on the call committee or the compensation committee. And I'm signing up for an evening meeting and unpaid work in the hopes that, or with the plan to, is probably a better way to say it, leverage that into something that can reduce my clinical burden, that can increase my admin time, where I can make a significant difference and be paid. Because a lot of people will raise their hand for a call committee and do it for a year or two and then opt out and not really go anywhere. But if you're really strategic about it and you say, hey, I'm not just signing up for whatever committee needs people, but I want to be the CMO. So I'm going to sign up for something that it's going to build the skills I need in order to get to that place. It's much less, let's just see how it goes, and more, I'm going to strategize to see how I can get from where I am to where I want to be.
I love it. I love everything that you're saying because I think that's right. It's not enough just to raise your hand. It's having that strategic approach and having enough confidence in your skills. Most of us are graduate school trained clinicians. We've had extensive backgrounds in math, science. Uh, we've established critical thinking. That work in an administrative environment still costs money. And so I think it's really important to recognize that you're volunteering or stepping up or adding this with a specific purpose. You're not doing it just so that becomes your new extra full time unpaid job.
Yeah. Yeah. Now, I would love it if you would speak to the listener who is like, but I'm not a doctor, right? So I'm looking around, and so many of these positions that we're talking about are filled by physicians or nurses. Nurses seem to have a real corner in healthcare leadership. I think it's because they are a grown up profession and we are hoping to be a grown up profession someday. But when you look around your organization, you say, I don't see myself represented in these executive positions. I don't see myself represented in who's the medical director. We have a CNO, but we don't have a CPAO. What can you say to that person to encourage them that they could be the first one to take that role as a PA?
Yeah, that's great. I'll start with sort of a little phrase. I'm sure you've heard this before. when your only tool is a hammer, all you see is nails. I think about that similarly uh, when the problems you're trying to solve all are being led by nurses. It's hard to imagine a non-nurse fixing them. And that's not to throw any of our nursing colleagues under the bus, but nurses have a volume of and a presence in administrative roles that we just simply don't. It's much easier to pick the people that you see all the time because they're the ones that are there. As far as that I don't see a CMO role or a CAO role. I think I think there's two things to really think about. Number one is you, while you may be the first in your organization, you're certainly not the first. I live in the greater Seattle area. I've been in the West Coast probably the last 15 years, almost last 15 years. And there's no shortage of PAs and nurse practitioners as executives, as chief medical officers. So getting connected with somebody who's got the job you want, understanding how they got there, that's a sort of a critical networking step. But I think the second thing but I'm not a doctor. Yeah, that's okay. In fact, um, that may mean that you have an entirely different and more complementary skill set to the administrative world than being a physician is. And remember, a clinical director, a medical director, an administrative leader within a healthcare system is overseeing healthcare process primarily. Yes, there are often providers of care, but if you're really looking for that administrative or executive switch, that's not about overseeing providers. That's about overseeing clinical process. And if you're a PA like I was a PA, and I suspect many of your listeners are, you've figured out how to get through the system. You've figured out the shortcuts. You've figured out what works and doesn't work. Now it's applying that knowledge to help create policy, to create procedure, and to really drive change in healthcare. And so I think where just because there isn't one doesn't mean that there isn't the opportunity there. This is especially important as we look at any publication right now. Physician shortages, all-time high. Nursing shortages, all-time high. There is nothing wrong with being available when a gap opens. And sometimes that, back to your initial comment about visibility, um, if you're the only person standing, that's an opportunity for you. So getting the opportunity to be in the room, be visible, be standing when the opportunity comes, because it's getting harder and harder to find clinical leaders in any market. So just being there is part of it.
Yeah, that's such an interesting sort of paradigm shift for me. So, when I have thought about clinicians who went on to be leaders in healthcare, I always, even though I knew people who were in executive roles, I always thought those leaders are leading people. They're just the chief clinician. They're in charge of the other people. And to think of that person as the person who's actually in charge of the processes is very, like, my mind is like, why didn't I think of that? Like, I never even considered that that's what they were actually managing, is not the people taking care of the patients, but rather the systems that those people are functioning within.
And I mean, people ask me why I decided to go to the administrative route and why I continued to pursue that. And then ultimately, up through the executive side. But it was really because I knew how I wanted to care for my patients. I knew the experience I wanted them to have, um, from everything from when they came in the door to the clinic, the conversations that maybe one of my MAs or one of my PA or nurse colleagues had, the discharge follow up, the documentation. I knew how I wanted to provide care to that patient. What being in an administrative role allows you to do is just take your personal brand of care and amplify it so that you have a larger impact on more patients, because now you're changing not just what you do on Tuesday, you're helping change what everybody does on Tuesday and on Wednesday and on Thursday. And I think that approaching it from a clinical process standpoint, uh, it first of all, it helps you as a leader because you take the egos out. We're not talking about how Tracy cares for patients. We're talking about what's the ideal experience for a patient. What's the ideal experience for any provider? What would they prefer in this environment? And so, as soon as you pivot to that sort of clinical process design, if you will, uh, that's where you recognize as a PA, you have a ton of value to add. We have tremendous value to add to the system.
Yeah. I think so many people working in the system are frustrated by the system and haven't previously had a path for correcting that. So, the thing that I found most frustrating when I was working in a large organization as a clinician is I was the person boots on the ground taking care of these people, transferring them from this hospital to this place. And I was the one that was seeing the inefficiencies and the frustrations and the fact that we were using a helicopter because we just couldn't get an ambulance. And that didn't seem like it made sense to me, right? Like one time I medevaced a guy for BPH because no one could get a catheter in and we didn't have it was just a big to do. And I thought this guy could have gotten an ambulance, but our network had grown and our ability to transport patients had not kept up with the amount of hospitals inside of the network. And I thought, this is such a waste. The guy was like, this is so exciting. I can't wait to tell my buddies that I flew in a helicopter for a completely non-urgent medical condition, right? But as the clinician, I felt like I was the one seeing the problems, but I didn't have any power to solve the problems, which led me to feel very helpless and resentful. Like I am the one who, might not have all the skills to fix the processes, but at least I know what's wrong because I'm here mad in the ER that I can't get this guy to me and I have to waste healthcare dollars on his transport.
It's sometimes, I think, that burnout slash ingenuity, as we get faced with more and more challenges in process, we find ways, often ingenious ways, to not really cheat the system, but short circuit what's in front of you. And I think that sometimes being able to bring forward to, maybe it's just your lead PA, it's a physician, it's IT, it's pharmacy, but bringing forward some of your efforts to sort of move through the system more efficiently will also get you that recognition that says, hey, so and so, Tracy's really figured out how to make this dosing pattern work for her. We should ask her to take a look at something else. And it does, again, start to open those doors. But you're right. You see it because you're in the middle of it. And that to me is the experience that's most critical. And as you progress through the administrative and executive ranks, um, I cannot tell you how many executives that I've worked with who have never rounded on a patient, who have never actually had, I'm going to date myself here, but 30 or 40 paper charts sitting down in medical records that I have to go back and sign off all the dictations manually. I know that's ancient history for some, but unless you've gone through that yourself, you don't understand what physicians, PAs, nurses are talking about having to circle back and finish up your documentation. They don't get it. And I think that having that real world experiences, I've been there, I've done that, I've had to work through these challenges. I can tell you what does and doesn't work. Um, Gives you such leverage in that conversation, especially compared to your nursing colleagues. When I think about nurses, nurses are expert at nursing. I also don't know a lot of nurses that spent the same amount of time doing H&Ps that I did. And so I have a very different take on how do I approach the patient? What's the patient conversation that I have? What are the things that clue me in that something different is going on here? I think that's the key that we forget is we sit in the sweet spot of having a tremendous breadth of medical knowledge, and we're on the ground level. And so that combination of having a broad understanding of medical care and then having the experience of being on the ground level of care where it's provided in the room, writing the scripts, following up with patients, it's hard to beat that combination. And honestly, for better or for worse, you know, we're significantly less expensive than an equivalent chief medical officer who's coming from a three, four, five, six, $700,000 salary a year. You can get an awfully nice raise to move into an administrative role that you may not have recognized was there for you.
Yeah. And so I tend to ask people this when they have atypical career paths or interesting jobs that I think would be tempting to our listeners. And that question is the grass greener on the other side? So when I think of executives, I think of you're always available via email when there's an emergency. You're the one they call, like not like healthcare emergency, like big systems emergency. Do you feel like your quality of life has improved after making this switch?
That's a great question. Um, I think overall, I would say yes. My quality of life has improved, and I will say that from a couple of different areas. And, there, as you progress through administration, and in particular into the executive leadership, yes, of course, there's financial compensation uh, that's greater. Um, you still have long hours. We work in healthcare. There's no way to get around. Healthcare doesn't stop at 5 p.m. But I would also say that most of the folks that work in administration and then further into the executive roles are also doing a lot of the same things. They're sharing call coverage. They're sharing so you're getting compensated a little better to have some of the same sort of availability. And I might get flack for this, but I'm just going to say it. There is rarely a time when I'm dealing with something as an executive that involves life or death. It can wait 5 minutes for me to wake up. It can wait 10 minutes for me to have a conversation. It is rarely life or death, whereas the stress of sometimes what many of us do as PAs, it is life and death. There is a patient waiting in pain for you to respond quickly. And so I would say that the work-life balance is a little more balanced on the executive side, but just like everything else, it is what you make of it. Um, I could be available 24 hours a day. I am not. And I think that it goes back to drawing your boundaries at whatever level that you're working with, is that when you cross over those personal work life boundaries, compensation must follow it. And you're the one that has to put your foot down and get it.
Yeah, absolutely. I would love it. We talk a lot about money on this show and the way that money and personal finance influence the way that we're able to make personal decisions and the decisions that we're making in terms of our career. Are you willing to share a little bit about your journey with how you had the startup to start a company at this point and what you did to sort of lead to the position that you're in now?
I absolutely, and I take no credit for this being original. This is a good situation or a good example of stand on the shoulder of giants. Probably one of the smartest things I ever heard was from one of my very first supervising physicians, a physician by the name of Brian Schroeder. Um, Brian also had interest in moving up through the ranks from an administrative standpoint, and he had learned from one of his mentors uh, that if you're going to make a change, you got to plan on how to pay for it in advance. And so, I've sort of morphed that into my own language, which is that if you're going to look to make a change in your career, whether it be from a specialty type, you want to move into administration, you want to move into an entirely different career path, you need to start with building up a pile of what I call of your FU money. Is that you have got to have a pile of FU money if you're going to make a big change. And what does that mean to everybody? It's a little different. Is it 2 months, 3 months, 4 months of basically income that allows you to take a risk? So that's the first thing. And an ironic twist. The one thing that I will say about administrative changes is that you have a lot more job security as a clinical provider of care than you do in an administrative role, because a CEO changes, a division director changes, you add, subtract. You're not nearly as likely to see PAs losing jobs as you are assistant directors or directors. And so, again, having that wherewithal to start putting money away to make a change, um, now amplify that over or expand on that over the last 10 or 15 years. I had a pretty substantial FU pile built up. And so I'm a single child of a single parent. I grew up the first kid to go to college. I did community service to pay for most of my student loans to sort of get out of debt, but I never wanted to go back to the environment I grew up in. And so I sort of aggressively put dollars away to so that if I really got to the point where on a day I couldn't take it anymore, I had no problem saying, "I'm done. I'm out. I quit." That was the first piece. The second piece that I think is really just important is recognizing that you may have to leave your organization to get the job you want. Um, I remember sitting down with a very sweet mentor, Sister Betty, when I was in Kalamazoo, Michigan, and talking about this opportunity to leave and move over to the administrator job. Um, I liked the hospital system I worked with. I liked the people that I worked with at Borges in Kalamazoo. Uh, but I wasn't getting anywhere. I was doing the volunteering. I was raising my hand. I was on this committee and this and that. But it was every time I had applied for a role, they're like, "Yeah, you're not quite the fit." And I had this opportunity to leave and go to the ASC, and I went to Sister Betty and I bared my soul, and I'm like, "I'm having a hard time with this decision." And she looked at me and she's like, "You know what? You need to watch out for you. We will be fine. You need to watch out for you first. And if you have the opportunity to leave and spread your wings, all that I ask of you is that as you go into your new organizations, take a few few self-pay patients. Remember Medicaid and Medicare. Remember the poor and vulnerable. But you go do what you have to do for you." And I think that you have to come in with the mindset that you might have to change jobs, change locations, change to get the job you want, but don't be afraid of it. Embrace it. Embrace it.
You might not know this about me, but one of my most despised tasks as a clinician is charting. That's why I'm always searching for hacks, tools, and tactics to make charting more accurate, efficient, and less of a huge pain in the butt. If you too want to spend more time connecting with your patients and less time pointing, clicking, and typing into their chart, you should definitely check out Freed AI. Freed AI is a medical scribe on a mission to free clinicians everywhere from the purgatory that is writing notes. Freed AI listens, transcribes, and writes your medical documentation for you. You can even use the code PA50 for $50 off your first month with Freed AI. These notes are written in your style and done for you by the end of the visit. Can you imagine what it would feel like to leave work on time, notes done, without having to crack your laptop open in the evening? Freed is HIPAA compliant, completely secure, and it takes less than 30 seconds to learn. Get back to what you love doing, treating your patients, and let Freed AI do the rest. Which is interesting. That is nearly a 180 from what the healthcare system wants us to believe. So the healthcare system wants us to be clinicians who feel like we are one with the system and that there is no designation of me versus my colleagues versus the organization, because that's how they make the most money. Like, yes, they care about patients and yes, they care about outcomes, but also they're a business that has to keep the doors open. So when providers, specifically, particularly providers who are salaried, have poor boundaries or don't take opportunities like that, they end up working more and more and more and just like giving all of what they have to an organization that honestly will never love them back, right? That organization, if you give notice, they will post your job tomorrow, right? They are not attached to you, so why are we attached to them?
Yeah, I completely agree. I completely agree. In the end, you are your own advocate, and remembering that you're your strongest advocate. And many of us are fortunate enough that maybe you have a couple of folks in your career that are truly your advocates. But at the end of the day, you're still your best advocate. You are your best advocate, and so if that mean for me it meant going to northern Wisconsin to run a surgery hospital. That joke of sometimes you got to go where nobody wants to go to get the job where everybody wants to go. Having the opportunity to be the CEO for a surgery hospital in northern Wisconsin opened tremendous numbers of doors for me. And was it a risk? Yes. And was my wife unhappy? Yes. And did we leave after 3 years to all my colleagues and friends in northern Wisconsin? Yes, we left. It was hard. But you have to be willing to do that if you're serious about taking the next step.
Yeah. Yeah, it reminds me of that saying, be firm about your goals, but flexible about the way that you achieve them. That if you want to do something, that you are committed to do it, but it's almost certainly not going to look the way that you think it's going to look.
Never, never. You asked me about moving into starting my own company, and I'll just sort of finish saying that in addition to that, having that nice pile of FU money, circumstance still matters. And for me, I had the opportunity to leave Providence. It was the right timing. It was, although my kids were in college, I don't know if that's the best time to start a new business. But between taking the opportunity to go through a downsizing and take a layoff and take some of that compensation along with me, that combination of it was the right time, I'd prepared for it, I'd always talked about building my own company. I'd built many, many companies for other folks, lots of surgeons. I helped them build their businesses. But I had decided at, the ripe old age of 53, I was like, I'm going to do this myself. And man, the one regret I have is that I didn't do it 10 years ago.
Mm. Mm. Let that be a reminder to those listening to not wait to make the choice or make the change or start to create some of that forward momentum that we've been talking about, to raise your hand and get in the room and sign up for the thing and just try it and see how it goes. And you're probably going to try it before you feel ready to do it. And that's okay.
And you'll probably make the wrong decision and you'll probably take the wrong position and you'll probably learn from it. My daughter hates this when I say it, is that we're either succeeding or we're learning. And so you're going to make the wrong decision. It's going to be the wrong time. You're going to take the wrong job. That happens to everybody. Just don't give up on that. You are worth it, and making that concerted effort. Make the changes to make it palatable, and then make the changes to make it successful. Don't be afraid of the risk. You'll figure it out.
Yeah. That's such an awesome place to end. So, Michael, if people are listening and they're thinking, I need more of Michael in my life, where is a great place that they can go to find more and to connect with you?
Oh, sure. So probably the easiest way is to drift by the website for our organization, which is LeftCoast Healthcare Advisors, www.lchadvisors.com. Feel free to seek me out on LinkedIn. I tend to be there more than probably I ought to. I'm still trying to learn boundaries as a business owner. Uh, Kudos to you, by the way, Tracy. I love the fact that you control your access. For anybody that doesn't know this, whenever you reach out to Tracy, if it's not at the right time of day, you get a response that says, I care about you, but I'm setting my own boundaries. That's a brilliant approach. Well done.
Thank you so much. And thanks for coming on the show and sharing your encouragement and wisdom with us.
Absolutely. It was a joy being here. And if you've got a listener out there who's like, I think I'm ready, reach out. Because if I can't help you, we'll help find someone who will help you, because it's okay. And listen to Tracy. She's got great advice.
Thank you so much.
Thanks.
I don't know about you, but I am feeling inspired. I love any reminder that says you can do it. However, you might mess up along the way. It gives us such permission to experiment and raise our hand and stand up and get in the meeting and get in the room and try it and fail and figure out that that way wasn't the way for right now. Or maybe that is the way for eventually, but right now we're going to try another avenue. An important reminder to look at your life and say, is it a good time for me to raise my hand for more work? Is it a good time for me to volunteer to do something unpaid as a strategic step along the way to get to where I want to go? Thank you, as always, for sharing your time with us and for tuning in to another episode of The PA is In. This PA is out. Congratulations, you've just joined an awesome club. By listening to a full episode of The PA is In, you are officially on the Unicorn PA team. Welcome aboard. What most team members do is they subscribe to the podcast because that allows them to automatically get the latest episode of the show. The life of your dreams exists on the other side of taking action. Keep making small shifts and keep getting better. Your life will improve, your career will soar, and you will have the confidence you need to create your own success. I will see you in the next episode. This PA is out.